Well, I'm sailing, yeah. Yeah. Oh, yeah.
Good afternoon, guys. Paul Haas here, physiotherapist. Today we're talking about Gripit ACTIVETAPE. Just want to talk about the knee technique today. We've done a few in this series, but today we're going to focus on the knee deloading technique. Just a quick summary about the Gripit Active. This is a nylon product, which means it has very long extensibility, and here's a good demonstration of how that works. Now, this tape is perfect and is actually designed to deload joints and muscles versus our Gripit kinesiology tape, which we call our clinical, which is designed to offload or deload the fascia. It's really important that people understand that kinesiology is for deloading fascia, but the Gripit Active, the nylon-based product, is to deload joints. Really important that we're using the right tape for the right reason. All right, let's get to the knee technique. Now, with the deloading of the knee technique, the essence of the technique is effectively to do that, to deload the knee. So it's not pathology specific. So if you're trying to deload the knee, you might be trying to unload a patellar tendinopathy, unloading some form of quadriceps tendinopathy, even arthritis of the joint, so just wear and tear, or a meniscal tear that's grumbly. So it's important that we just focus on the deloading technique to try and offload a structure that is either injured or compromised. Okay, so let's get to that technique today. Now, I'm going to start with the 5 centimeter here as an underlayer. There is a few different ways you can do it, and you can also look to provide a technique where you might choose to do 2 layers, so a double layer technique, and a combination of the 5, the 7.5, or the 10 centimeter. So let's start with the 5 centimeter as the underlayer. Importance around the edges so we don't see any sort of giving of those ends, which can happen if they're sharp edges. Also too, you may choose to use some form of pre-spray when you're doing this technique. Now, important is your starting position. If you're used to the traditional kinesiology method, you would normally have the joint in a lengthened position. So for the knee, that would normally be in a flexed 90-degree position. But with the active tape, we actually start the limb in a shortened position. So it's very important. There's a big difference there because we're trying to unload the joint. Okay, so with our 5 centimeter strip, we can start around the mid area of the quadriceps muscle, but you can extend that if you wish to, if you really want to provide a very strong anchor point. Okay, so we have the anchor, and I like about a 2-inch anchor. And with the other end of the tape, we can stretch the tape. You can see that stretch there. And again, we're going all the way down today, so that's quite low, maybe a little bit lower than usual, but that's okay. Again, because of the lever arm, it means we'll get that great extensibility, and what will happen is a shock. If we just go back to our bungee again, the load goes into the tape, and all that energy in there has to come out, and that's a recoil effect. So the tape absorbs the load that normally would go completely into the knee joint. Some of it goes into the bungee, and then that has to get out, and it pops back out. And so you get the recoil motion, which means the knee's not working as hard. Okay, so that's the first layer. And then we may choose to do maybe a 7.5 or a 10 centimeter overlayer, or even just 2 5s. Up to you, depends what you feel more confident with. And today we're going to do the 10 centimeter on top. Okay, so I usually cut this just a little bit smaller because the nature of this tape is that it's got a greater surface area because it is 10 centimeters across. Okay, so around the edges, between the layers, we might apply some spray, and that just makes the tape really stick to the other layer well. Now, if you've got a young child or someone who's quite light and you want to get some level of moderate offload or deload, this may be enough for you. Okay, so this 5 centimeter one strip could be enough. But we've got Danny here who's got a big body, and so we want to deload Danny as much as possible. He's about to run a marathon, and so we want to make sure he's heavily deloaded so that a lot of that load that's going through the knee joint is in fact going into the tape. Okay, so here's our second layer. Now I'm going to crank this up, guys. So generally if I want to crank it up and I've just got myself and the patient or the player or the athlete, Danny, if you could just put your hand there so they can hold that anchor, and as they hold the anchor, you know you can really crank that up and get that effect, the stretch effect that you're after. Okay, so here you can see I'm cranking that up there. I generally lay it down around the bottom here and then quickly lock off my end, and then you can just work the tape a bit if you want to. So because it stretches 4 ways, so it's a multi-directional stretch tape. Thanks, Danny. You can sort of stretch it out a little bit that way as well if you want to. Now the glue is acrylic, so it likes to warm up, get around that 35-degree sort of point before it really starts to stick well to the skin. So a little bit of heat activation with rubbing is great. And so what you can see there is that we've created this stretch of the tape with the limb in a shortened position, and there's no chance in hell that you can do that with the Gripit kinesiology tape, and that's specific for fascia. We're trying to actually deload the joint. So from that point, I'll get Danny to bend his knee and straighten out again. And so if I just put Danny's leg up here and drop down Danny. So you can see this massive tension and energy that goes through the tape, and it almost acts like a bungee. So Danny's, if I try and look at that sort of flexion to extension moment of the knee, I can actually feel that that is really easy to do because the tape is assisting with trying to encourage the knee back into extension. And that's the mechanical advantage of this tape, that it actually allows extensibility and tension, because I've already put that on stretch, so it's already now providing a little bit of tension. And as I flex, that load and that potential energy into the tape is not taken into the knee, and then it has a potential to bungee back out again. Okay, so guys, that's pretty much the technique for the knee. Thanks for listening. Give it a go. Remember to apply that tension with the knee in the shortened position, and I'm sure you'll go a long way with improving your patience and breath.
Oh yeah.